Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Marcie Lafido. She's Chief Nursing Officer at Endeavor Health Elmhurst Hospital. Welcome, Marcie.
Hi, John. Thanks for having me. I'm glad to be here today.
Yeah, I always love having nurses on. And, I think nurses are the gem of healthcare. But so I love that you have that. You agree? But lots to talk about, when it comes to nurses, the workforce and the technology that's being used. But before we go there, tell us about yourself and Endeavor Health Elmhurst Hospital.
Yeah, of course. So I'm Marcie Lafido, as you said. I'm the Chief Nursing Officer at Elmhurst Hospital, which is part of Endeavor Health. I have been the Chief Nursing Officer for about 4.5 years here now. I have been with Elmhurst Hospital for just over 30 years. So the majority of my nursing career, mostly in cardiology, a little bit of population health, some care coordination, and then more recently as the Chief Nursing Officer. I also am an advanced practice nurse by trade. So I did that for a number of years. Elmhurst Hospital is a community hospital. It actually turns 100 years old next year. Wow. Fortunately, we are not still in that 100-year-old building. We moved into a new building in 2011. But like any other community hospital, we have a strong tie to our community and are now part of Endeavor Health, which is a 9-hospital system, 8 acute care hospitals, and 1 behavioral health hospital.
That's awesome. Well, like I said, I love having nurses here, but there's been challenges when it comes to workforce and nursing. What would you say are some of the workforce challenges that nurses and nursing leaders like yourself face today?
Yeah, I think, the top one is going to come out every single time. It's staffing and retention. It's probably been exacerbated since the post-pandemic world. We kind of had some mass exodus of bedside nurses. There was a heightened awareness of burnout and just some people kind of leaving that part of the workforce. I think staffing has been an issue since I was a bedside nurse, right? When you're talking about taking care of patients at the bedside or that come through an emergency room, you can't exactly have somebody call in and not backfill them. And so that is definitely still one of the challenges that we have. Endeavor Health has been doing a lot of work on righting that situation.
That's awesome. Talk to me about that. Like, what can be done to address these workforce challenges?
Yeah, I think some of the biggest things for us are really understanding what it takes to be a nurse at the bedside, really understanding what our nurses need. There's a lot of work between HR and some of our executive leaders and just our frontline staff in nursing on how do we retain the best nurses? How do we encourage people to come into our organization and stay? What is it about the culture here? What is it about what we offer as an organization that keeps nurses at the bedside? I'm super proud to say in the last several years, kind of went through those post-pandemic challenges, had a lot of agency nurses. We created a really innovative staffing model. We called it an internal agency. So a lot of the nurses at the bedside, especially the experienced ones, were kind of drawn to those dollars that went with going traveling or doing agency nurse. And so we created an internal model. And within a few years, we were able to kind of wean off of that model. Both external and internal agency have been out of Elmhurst Hospital in the past 2 years, and Endeavor is almost done with getting all of that out as well. And what that means is that our nurses are coming back and that they're staying. We're seeing stronger cohorts of nurse residents come in. We have a really strong transition to practice and nurse resident program. And it's the number of applicants, we're getting over 200 applicants for, 30, 40 positions. And so it's been a really great transition.
It's interesting you didn't say, a pizza party or a yoga class, like.
And we still do that. And I've heard all the jokes about pizza parties and I get it, but they do appreciate it in the moment when it's happening, right? So that is kind of, for me, the pizza parties are the extra. It's a really bad shift. We're having a really bad time. We know you're going to have a tough time. We're going to send up some food. We're going to make sure you don't have to kind of run out of here. But that is definitely not on my list of approaches for the recruitment and retaining of our staff.
Yeah, you're right. I mean, people do enjoy it, but I think to that point, it's not what's going to retain them long term, yes. Right? I think that's an interesting challenge. And yeah, I obviously jokingly say it since many people say that's our effort. And it's like, it's a little shallow.
Yeah, yeah. And
So,
I would say we touched a little bit on it, but one of our other big issues is that kind of um, the well-being of our nurses, right? That has been a huge focus for us since the post-pandemic as well. We actually had put what we call employee support coordinators, and now at the Endeavor system, they're called RISE, or Response Incident Stressful Responders. And they are there for the staff, right? So they are there to support the staff in what they need post-traumatic event, just in their day-to-day life. They're a conduit to our staff to some of our resources that we offer to them. It has been a hugely successful program across Endeavor, and something that we kept in place after the pandemic and really just see as a valued asset for our teams.
yeah, that's really cool. As I kind of alluded to at the beginning, like nurses are some of the most trusted and loved, quite frankly, people in healthcare and have the most contact with patients in most organizations. When I think about times I've been in the hospital, it's all about the nurses. I barely even remember the doctor, right? Like, so it's interesting, like, why don't nurses have a bigger voice in healthcare? And, obviously for our show in healthcare IT in particular.
Yeah, that's really interesting because I saw that question kind of in my pre-materials, and I will say that I don't think that we feel that way at Endeavor. I
Oh,
think,
interesting.
I have been at Elmhurst and now Endeavor for a very long time, and the entire time we've had really strong voice. We have our 8 acute care hospitals have all are magnet designated. And that has been true for each hospital's on between their 3rd and their 5th designation. So that's like, almost decades sometimes of advancement in nursing that's happening in our organizations. We just went through at Elmhurst our 3rd designation, and for the first time got it with distinction for 9 exemplars. And 2 of those, in addition to some quality and patient experience metrics, 2 of them were based on staff engagement, nursing engagement, and we have a BSN population greater than 84.3% of our nurses hold a BSN degree. And so when I think about what it means to be at a magnet organization, what it means to be at Endeavor, we also have a very strong shared governance, which is now leaning towards professional governance. It's a new model of the shared governance structure. We all have very strong structures within our organizations where the nurses at the bedside are leading unit councils on their units. They're involved in central councils at their hospitals. And now in the last year, we've stood up kind of that system structure, right? So people are coming together as a larger, 8 acute care hospitals setting, and our ambulatory physician groups to talk about what do nurses need, how do we implement, what are the best practices, what do I see at the bedside that's not working well or could be changed, and really giving them that very strong voice.
Interesting. Well, I mean, credit Endeavor for that, and the fact that they have a chief nursing officer like you says something as well, because some don't even have that, which is
Oh yeah.
kind of crazy to think about. But
That's
like
actually,
how? Yeah, go ahead.
sorry, before you get your next question in, that's actually a really good point, because not only do we have chief nursing officers at each hospital, we have a chief nurse executive as well, who really sits for us at that highest table, and we're all very involved with each other. So I think that shows kudos.
Yeah. So how do you make sure that the nurse's voice is heard? Is it through those committees, or, how do you approach making sure that, the things that matter to nurses are heard by the IT staff, by the leadership?
Yeah, I think so. There's a couple pieces that I'll take. So just in general, having their voice heard, yes, it happens through the committee work, right? The very top committee at each hospital is led by the CNO. So it is a way for information to travel up and down through the channels for nurses to the CNO. But you can't just have it be that way, right? You need to have a relationship with your nurses, and you can't have a pass you in the hall, tell you about my weekend with 1,200 nurses, right? But you can have I'm going to say hi to you. I'm going to come by. I'm going to shadow on your unit. I'm going to round on your unit. I'm going to talk with you and find out what's happening. I and my peer CNOs find that if we actually put on our scrubs and go spend 4 hours on a unit and just help, right? We can answer a call light. We talk to nurses, that people are more willing to kind of get into this. They may say the first time you see them that morning or that day, oh, I'm fine, everything's fine. But about an hour, 2 hours later, they realize you're there, you really want to know what's happening, and they'll start to talk to you. So we do get a lot of involvement that way. We have research, we support research. We have in our resident program, our residents do an evidence-based project before they graduate from the resident program. 2 of those were just submitted to go forward to the Magnet Conference in 2026. So we really support in our nurses that continued growth, that bringing things forward, that being involved. We do things like CNO chats or town halls where we kind of update, and those are led by the CNOs, and have an opportunity for questions to either be emailed in or asked right in the chat box during those as well.
Yeah. It's interesting that I've done the same as an IT person, like go sit at the nurse's station and just don't do anything, like in my case, I can't help the way you could, but I would just sit there and you're right. After, if I sat there for 10, 15 minutes, oh, John, I needed to talk to you about this. You're like, oh yeah, you just never got to your email or whatever. Now I'm here present. There's a value in presence. It's super interesting.
Yeah, and the second part to your question, to talk a little bit about the informatics and the technology piece. So we at Endeavor also have a very strong nursing informatics program. We've had it for as long as I can remember, ever since EMRs became mostly electronic, right? And so ever since those medical records changed, we've had nurses and we've had teams of nurses kind of growing through their careers more towards the technology aspect of things. So Endeavor has not only a very strong nursing informatics team, but also just recently hired our first CNIO. So extremely excited about that. All of the CNOs are very excited because now at kind of every level of nursing, we have that support in technology. Endeavor itself also has a really strong innovations team who is always coming at us to pilot things and try things. So we've actually been able to step into the world of virtual nursing a little bit, and are in the middle of a pilot at two of our hospitals, 2 different units, to work on that as well.
Yeah, I think you'll like it. It's one of my favorite technologies.
Yes.
What would you say the nurse's perspective is on the impact of technology on nursing? Where have you seen challenges? Where have you seen successes with technology? Because you're right, EHR, became many nurses' life, right? That was the new documentation. But I'd love to hear your perspective and kind of the nurse perspective on the impact of technology for good and bad.
Yeah, I think I'll start with the challenges. I think one of the big ones is the amount of documentation that's required, right? And the amount of systems that you have to learn and understand and how they work together. The regulatory things, and for obvious reasons, right? We're taking care of human lives here, and things we do need to be documented. The saying in nursing is, right, if you didn't document it, you didn't do it. And so there is a lot that has to happen with that. And even though our electronic records have really set us up for documenting by exception, that's not a natural response, right? You still want to say if the lungs were clear and something was stable, and not just make it be an exception. So that's part of the battle, is really kind of weeding down what's necessary and what has to be in there. And then the time to do it, right? It's one of the things you and I, we talked about virtual nursing. It's one of the things I love about it is the amount of time given back to the nurse at the bedside, because somebody else can come in and do some of the lengthier documentation and some of that one-on-one with the patient. One of the other things is, and I get this all the time, right? They're carrying phones, there's a telemetry monitor, there's, the computers, there's the alerts, but it's that alarm fatigue, right? It's that there's the constant, like, my phone is ringing, this is happening, I'm trying to talk to a patient, and it's going off and going off and going off. And so the more we can figure out how to streamline, I think, and minimize some of that noise, the better.
Yeah, that makes sense.
Yeah, for successes, right? It's some of the same stuff. The documentation being in the medical record also allows you to kind of do it at the bedside while you're with the patient. I know that our physician offices are trialing some of that AI ambient documentation, or the AI documentation in the offices. And I am really excited for that when we can bring that to the bedside, right? When a nurse can actually spend time talking to a patient, looking at a patient, and still get the documentation done. I also think the medication barcodes, the working with the IV pump so that things can be directly put over. I think stuff like that is really exciting, and hopefully will be coming to us soon. And then other easy things like decision support tools. the tools that help us, like where you get an alert in your EMR that says, hey, your patient could have sepsis, right? Those kinds of things are very helpful for a nurse who's running around really busy and needs kind of that alert sometimes as well.
Yeah. No, for sure. You're 100% right that, it's funny. We don't talk about the fact that they don't have to chase paper charts anymore because we take for granted whatever we automate, right? Like, oh, now we just search and the whole record's there. But you're right that when we did that, we hoisted a bunch of extra documentation burden as well. You mentioned AI. I'd love to hear, how do you see AI impacting nursing? The ambient stuff, I think, is the most exciting thing for doctors, nurses, for everyone, I think, in healthcare. But how do you see AI impacting it? Like, what's the trust level with nurses? I think that's going to be an interesting one with AI as well.
Yeah, I think it's interesting. I think AI is new for us, right? Especially someone of my generation. The first I heard of it was my kids talking about, how do you put it in to get a paper, or how do you put information in? And we're becoming much more familiar with it. I think the first thing, if you go to search for anything, the first thing it does is give you AI now, right? And so you become a little more comfortable with it. I was literally having a conversation this morning with one of our leaders upstairs who was talking about, it's performance review time. And how do you mobilize like an AI or something to help you kind of put your thoughts in this succinct format, right? And I think it can be intimidating, right? I can go back to, we implemented robots recently, probably in the last couple of years. And I can remember when we first came with the idea of having robots who can deliver medications from pharmacy that can't go through the tube system, or deliver to places that don't have a tube system, or take a telemetry box to a patient instead of that staff member having to go off the floor. The initial responses were being replaced by robots, right? And that is not, it's not the case. Even with our virtual nursing, we're not replacing the nurse at the bedside. All of it is supposed to be supplemental. It's meant to give the nurses at the bedside back the time with the patients. When we think about what nursing has transitioned into over the years, the patients are much sicker. There's much more responsibility. Nurses are working at the top of their license, which is a wonderful thing, but also can be exhausting. And so for AI to be accepted in nursing, I think we have to think of it as an assistant, as something that helps them get their work done, not something that's going to change their bedside ratios. And so we are very careful in all our communication. Virtual nursing, exciting, so much fun. Everyone's excited about it and wants to see it, but it's one of the first things we have to say is this is not intended. I'm not coming back in a year to say your ratios are changing now. Mm-hmm. This is truly meant to invest in better care for our patients, better communication for our patients, and better support for our staff at the bedside.
Yeah. There is an interesting perception. I love the robot example though, right? Although now I bet they love it because they're like, wait, I don't have to walk to the pharmacy 7 times a day.
Yeah, absolutely. It's been a game changer. And when you think about the number of steps that robot does in a day, and we actually have 4 here. So when you think about that and then the time it's saving from your tech who's going to answer a call light or prevent a fall on a patient from not being off the unit because you needed them to go get XYZ from somewhere. It really is a huge game changer.
It's so true. The walk to the pharmacy is not a value add, right?
Right. Absolutely. 100%.
Doesn't take any intelligence. It just takes
100%. And they say the robots never get sick. That's not entirely true, but they do work 24/7, right?
They can get sick, but they work. That's interesting. I love that. Well, we always like to wrap up these episodes with a little career discussion, career advice. I'd say for an aspiring nurse leader, what advice would you give them if they want to be the next chief nursing officer?
Yeah, I think this is one of my favorite questions. I get asked a lot, and I think you need to take advantage of opportunities, right? So when I say to my brand new nurses who come in and they're like, how do you get to you, or how do I get to be a leader? I'm like, you get involved. You sign up for these shared governance or professional governance committees. You get on teams. You get involved in research. You make sure your voice is heard in all the areas it could be heard. And then you find your mentors or you find your leaders. I have learned things from every leader I've ever had, whether it's good or bad, but it shapes who you are as a leader and it helps you know who you want to be going forward. And that getting involved piece for all of us, for all of nurses, I would guess 99.9%, the very first leadership role we had was being the charge nurse or the team leader. right? Or a preceptor to another peer coming on to work. And those are the stepping stones that get you to places. I always say to people too, if you have a leader come to you and say, I think you would be good at XYZ, listen to them, because they are seeing a quality in you that speaks leadership to them, that speaks someone that they want leading their team, and take advantage of situations like that.
I love that. Say yes, right?
Yes, absolutely. I say it all the time. It's why innovations is not afraid to come to me, because I'm going to say yes, because the team here really embraces those kind of changes that we get to be a part of.
That's cool. Some great advice. Well, Marcie, I appreciate you taking time to sit down with us to give us some perspective on the nursing perspective of what's happening, especially on the IT side, since we're the CIO podcast. But thanks so much for taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast applications. Thanks, Marcie.
Thanks, John. I appreciate the time.